dynamic county. And I'm going to kick it off with having them introduce themselves because they are dynamic within their own right. So first, I'll start off with Rhonda McClinton-Brown.
Good evening. My name is Rhonda McClinton-Brown. I am the branch director for Healthy Communities branch in Santa Clara County, the County of Santa Clara Public Health Department. I'm happy to be here. I live in San Jose. Spent most of my life living in this county, so I'm so excited to be here with you this evening.
All right. And our next panelist, the dynamic Alma Burrell.
Good evening, everybody. Hello, Milan. My name is Alma Burrell, and I'm Associate Director with Roots Community Health Center, and I'm very happy to be here. Thanks.
Thank you for being with us today. I know you all have productive and busy schedules, and I know we have a nurse with us today. And I think this is going to be my second time meeting you and hearing your name. And rather than me mess it up, I'm going to allow you to let the people know who you are. You will put your crown on and let them know who you are.
Hello, my name is Euredis Chipendo, and I'm a family nurse practitioner with Santa Clara Valley Medical Center, and currently with the Valley Homeless Health Program, and providing telehealth care for patients with COVID-19 that are quarantining in the hotels within Santa Clara County. And I'm glad to be here.
Thank you for being here with us. And see, young people, there's a lesson there. I actually was believing not so much in myself to say her name, but just as she said it is how I was going to say it. But now that we know, always go for it the first time. If you get it wrong, they'll tell you to get it right. So this is how our discussion is going to work. You can put questions in the chat, and our panelists will be able to answer these questions. We do have a short time with one another before we have to gather back into the main room. But for now, we are going to go ahead and ask all of you to look at the bottom of your screens. For those of you who have phones, or you're on your laptops or your desktops, there is the option for you to put questions in the Q&A. There's ability for you to put something in the chat. And then there's also for you have the ability to do Q&A by raising your hand of any questions that you may have of our panelists. Panelists, please remind me just so that I can make sure, and go ahead and put your mics on mute, everyone, so that we can control any noise that might pop up. If you do not know if your system is not on mute, please look below to see if there's an X on your mute button. If there's a red X, then that means you are on mute, but if not, please put yourselves on mute. So wonderful panelists. Please correct me if I'm wrong. Are we still showing the video or no?
No, we're going to just start off with the slides, and in the end, Perfect. We'll just show the link of the video.
Perfect. So we're going to start off with our slides. And let's give a round of applause to our tech, Miss Essence. Thank you.
Thank you. Thank you. I'll get started. Rhonda McClinton-Brown, again, branch director for Healthy Communities for the County of Santa Clara Public Health Department. I'm just going to kick us off with a few broad statements about COVID, specifically in Santa Clara County, and then I will turn it over to Alma Burrell and Euredis Chipendo, who will wrap up our talk. And then we'll go to question and answers. And if we have time, then we'll show the video. If not, we'll just show the link. So you can go to the next slide. So first of all, I want to say that COVID in Santa Clara County has been a collective effort. We would not be able to address COVID as significantly as we have without trusted and partners and leaders within our African ancestry organizations. And so it's wonderful work like Unity Care and Black Leadership Kitchen Cabinet and African American Community Services Agency, Roots Community Health Center, UGMA Family and Adult and Family Services, the NAACP, Emmanuel Baptist Church, Maranatha even, and Santa Clara Valley Health and Hospital System. We've all worked collectively together and in different ways to really address COVID. And you'll see a lot more of that during Alma Burrell's portion of this presentation. It really takes leaders to connect to our communities. And that's one of the most important strategies I want to emphasize today. So you can go to the next slide. I just want to say a few facts about COVID. You heard in the big group the impact that COVID has had on the African ancestry community nationally and locally here. In Santa Clara County, we are about 2% of the population, but we have the second highest cases rates of COVID in the county. It doesn't pop up because we are a small percentage of the population in the county, but we have been impacted significantly. We're about 2% of the cases, 2% of the population, but our death rate has been about between 4 and 8% of all the deaths of COVID have been among African ancestry communities. So we have died at a higher significant rate than other populations in the county. And then when we move toward vaccines, since we have been disproportionately impacted, you can see on this chart that we have access to vaccine at a much lesser rate. And so I think Dr. Nadine Burke-Harris said that we've vaccinated 15 million people or something like that in the state of California. In Santa Clara County, this slide was made on March 19th, but I went today, you can go back to the other slide. I went on the website today, and as of today, the county, can you go to the previous slide? The county has vaccinated 506,000 people, and about 9,000 of those vaccinations have been of the African ancestry community. So a little bit less than 2%. So we are really not getting vaccinated quite at the rate that we need to. If you think about, we've been disproportionately impacted by COVID. We should be being vaccinated at a much higher rate than we are represented as a population as a whole. So we have some catching up to do there. You can go to the next slide. And so particularly related to vaccination, I want to again emphasize the collaboration that we have in the community and the importance of really having trusted agencies and organizations and places where our community feels comfortable being the leaders in our COVID and our vaccine response. So Roots Community Health Center, UJIMA Adult and Family Services, African American Community Services Agency, Unity Care, NAACP, all of the Black churches, Black Leadership Kitchen Cabinet, and the County of Santa Clara are all working together to do a couple of things that are really, really important. So one is having up-to-date information about COVID, how COVID has impacted us as Black people, how do we stay safe? How do we advocate for ourselves in a safe work environment? How do we keep our families safe? What can we do to protect ourselves? Where the vaccine is concerned, there's a lot of information that's needed. Is the vaccine safe? What does it mean for Black people to get the vaccine? How have we been involved in the research and the development of the vaccine? If I decide that I want to take the vaccine, how do I get the vaccine? How do I find out information about where to get it? We know that there are disparities in healthcare access, regardless of whether people have insurance or not. We have a harder time accessing healthcare. There are systemic issues and structural barriers that keep us from getting the healthcare that we often need. And so when we typically go to our healthcare providers to get vaccine, but now that doesn't seem to be as possible, where do we go to get them? One of the things that we've been implementing in the county in collaboration with all of these organizations is expanding access to vaccine. So taking the vaccines to all of these places and the community sites where people feel comfortable. Roots has clinics. We have mobile vaccine clinics that are popping up at different places in the community, at community-based organizations, at shopping centers, at workplaces, at churches. And we also have large vaccine sites at places like the fairgrounds, Levi Stadium, big, large buildings as well. Taking vaccines to a community where people really feel comfortable and can access them outside of the healthcare system. while the healthcare system is also providing vaccines. Providing vaccine has been a huge lift in this county for everyone, healthcare providers, community-based organizations. And so hopefully, eventually in time, people should be able to get their vaccine at their healthcare provider. That's the goal. But right now, when we're struggling with vaccinating every single person, all 2 million people in the county, it's very difficult to do it at the same time. So we have many, many pop-up options, many, many mobile options, and many options at places where communities feel comfortable, where our community feels comfortable getting the vaccine. And then the last thing I want to say, and I'll turn it over to Alma Burrell, is there's limitations in getting the vaccine. So, you have to have technology. So we have a system of registration support that our partners are really engaged in, who can help people schedule appointments for vaccines so that they can get them when they need them, when they want them, at places that they feel comfortable with. You can go to the next slide. So I just want to say really quickly, and then I'll turn it over to Alma, is who's eligible for vaccines right now. Right now, vaccine supplies are limited, but it is quickly opening up. So if you're over 65, if you live or work in the county and you work in agriculture or food, education and childcare, and when I say education, I don't just mean you're a teacher, but you work in an environment that provides education. So it could be childcare, it could be a school, you could be a landscaper that works in a school setting, or a janitor that works in a school setting, or a social worker that works in a setting. You could be a therapist of some type that works in a school setting. So it's very, very broad. Emergency services, and people 60 to 64 with high-risk medical conditions, which I have listed on the right there. You can find this information out on the county's website. If you look at the County of Santa Clara Public Health Department website, or you can look at the California Department of Public Health website as well and get this information. So and go to the next slide. And then this is where you can find, if you go on the website, you can find a list of vaccines. And I just wanted to highlight a couple of things. You can go to sscfreevax.org and get information on the vaccines. You can also go to your provider and have vaccines. But I want to let you know, Roots is going to talk a little bit about the vaccine clinics that they're providing, which is amazing. And I also want to let you know that Emmanuel Baptist Church is also having a vaccine clinics Tuesdays through Friday from 9 to 3:30. And we'll provide information for you if you want to get scheduled for a vaccine appointment there. Want to go to the next slide? Yeah, and then I'm going to turn it over to Alma Burrell.
Good evening again, everyone. I'm just going to talk to you for a few minutes based on my perspective as a provider with our feet on the ground, with our boots on the ground. And I just want to give you a little bit about what we're seeing and hearing from our community. So first of all, what we're finding is that our middle age and elders are excited about and anxious to have the vaccine. They actually really want it. They don't always know where to go to get it, but they are willing to take the vaccine. Where we're seeing the hesitancy is mostly among our younger people. So our 20s, 30s, and even into 40s are a little bit more hesitant. And when Dr. Nadine said that we'd be opening it up on the 15th to everyone, I know that we really have to get up on our social media game because, and I say that because that is where a lot of our younger people are getting their news from social media. Because I actually had two people ask me today, younger people ask me today, how much is the vaccine? So they don't even know that it's free. So, we're going to have to really do some more targeted campaigning to that age group. But I want to say too that knowledge is power. So one of the way we've been addressing things in our messaging is that we're not telling people go get the vaccine. We're not trying to not trying to, give orders or command people, our African ancestry folks, that you need to go get the vaccine. We're not taking that approach. We are just providing facts. We're just providing, we're providing the science. And what we're finding is the more that people learn about it, the more comfortable they are with taking it. So we've just really been targeting our leaders. So we've been vaccinating a lot of our pastors. And then once the pastors have the knowledge, and our community leaders have the knowledge, and they get vaccinated, then others tend to follow them. And that has been really, really successful. Just really, really targeting towards our leaders. And so one of the things that we've been doing is offering these pop-up clinics to churches and to other community organizations. So I think you can go to the next slide, and we'll just give you a sample of some of the things that we're doing. That's where we're located, on the corner of the Alameda and Heading, and we are housed with Ujima Adult and Family Services. You can go to the next slide. So we've been doing vaccinations at Sunrise Middle School every Wednesday from 10 o'clock to 3 o'clock. And that is a walk-up clinic. We're trying to make it as accessible as possible. You don't need an appointment there. You can just walk up. And then we also are doing pop-up clinics in different places. So on the 13th, we were at Jerusalem Baptist Church, which is in the city of Palo Alto. The interesting thing about Jerusalem Baptist Church is the pastor there had been trying to get testing there. He had been trying to get vaccinations there, and he didn't know where to go. And at some point we were finally connected. And when we went there, we were surprised. The line went down and around the block and almost met again at the beginning of the line. There were so many people there, and I would say it was 90% Black and brown faces there. And the people there were so grateful, because they said that they don't get very much attention in that part of the county, that most everything is in San Jose on the east side or in Gilroy, but the people tend to forget that we live further north in the county. And so we do have populations of people that live all throughout the county. That's the interesting thing about our African ancestry population here in Santa Clara County. We are not in one geographic area. We are spread throughout the county. And so really it's just we have to take this vaccine to places where our people congregate. So being at Jerusalem Baptist Church was really a positive for the community there. This weekend we'll be at the University AME Baptist Church. And then next month we will be at the Ethiopian Community Center. So the community leaders have really have been wonderful partners with us, and they've been convincing and talking to their people and giving them the support and the knowledge that they need so that they will come out and be vaccinated. On Thursdays, we vaccinate from our office by appointment, and we've had really tremendous success, because on Thursdays there's no line, and typically on Thursdays, Molly got her. Hi, Molly. And then typically on Thursdays, that's when a lot of our pastors and leaders come. And I'll tell you, last week we had 50 Ethiopian elders that came. It was a beautiful sight. And then they tell us they have so many that want to be vaccinated that will be going to the Ethiopian Community Center next month. So we just got contacted by the African American Catholic Church that also wants us to come there. So what I'm saying is that our people want to be vaccinated. They just may not know where to go to get it. I'm talking about our elders and our more middle-aged people. They may not know where to get it, but they actually want the vaccines. And so most of our messaging really needs to go to continue to provide that knowledge, that education for folks, education, and then targeting our younger folks when it opens up for everyone. But we are available to the community. We're here on Wednesdays, we're at Sunrise Middle School. On Thursdays, we're here at our office, and I will put our phone number in the chat. And then on Wednesdays at Sunrise Middle School, on Thursdays at our office, and then on Saturdays, we're doing pop-up clinics. So I will put a phone number in the chat so that you will, anyone that wants to be vaccinated by appointment can call our office. And then I'll give it over to Euredis.
I'll do that right now for you.
Okay, thank you.
Mhm.
And Euredis, I'll turn it over to you.
Thank you. Good evening to our Black community in Santa Clara County. I am Euredis Chipendo. I'm a family nurse practitioner. I am a daughter, I am a mother, and I'm also a sister. I'm here with you today to share with you a very important message about the COVID-19 vaccine. I and the medical community recognize that there are community members who are hesitant to get the COVID-19 vaccine because it's a new vaccine that was developed in a short time. First, let's talk about the science behind the Moderna and the Pfizer vaccines. Contrary to what you may hear, the technology used to create these vaccines is not new, and it was discovered 30 years ago. Second, these mRNA vaccines do not alter your genetic code, which is called the DNA. The RNA in the vaccine does not interact with your cell's DNA, so the vaccine does not have the ability to change your genetic makeup. Because it is much easier to make a lot of mRNA vaccines than other conventional vaccines, and the fact that the vaccines were being made while the clinical trials were being conducted, the pharmaceutical companies were able to save a lot of time and make these vaccines available quickly. The third vaccine that received FDA's emergency use authorization, the Johnson & Johnson's vaccine, uses a type of common virus called adenovirus that has been modified to just carry the genetic code of the COVID-19 virus that is responsible for the spike protein that allows the virus to attach to our cells. This vaccine does not have an intact virus to it, and it cannot harm us. All three clinical trials included patients from different age groups, 16 years or older in the Pfizer and 18 years or older in the Moderna and Johnson vaccines. They also included patients from different race and ethnicity, like African Americans, Hispanic or Latino, whites, and Asians, and others. And they also included patients people who had other medical conditions. Even though they were developed quickly, they were studied just as thoroughly as other life-saving vaccines that we routinely use with our patients. And all three vaccines have been proven to be safe and effective. The most common side effects from the vaccines include local symptoms such as soreness at the injection site, swelling or redness or itching. And some people may experience some moderate side effects such as a body ache, a headache, or mild fever. These symptoms usually resolve within 2 to 3 days. Immediate allergic reaction and severe allergic reactions such as anaphylaxis is extremely rare. And to safeguard against these very rare but treatable reactions, all individuals being vaccinated are monitored for at least 15 minutes. Now, why would anyone take the vaccine? And the answer is vaccination is a much safer way to develop immunity against COVID-19 compared to getting the COVID-19 disease itself. If you are infected with COVID-19, you may get very sick or die from the infection. Also, it's probably likely that immunity from COVID-19 vaccines is stronger and longer lasting. Even if you had the infection and recovered, we still recommend that you get vaccinated to ensure that you have an adequate immune response to protect you against reinfection in the future. Is the COVID-19 vaccine safe for pregnant and lactating women? And the answer is yes. The experts in maternal and childcare have issued statements to the safety and efficacy of these vaccines. These vaccines do not have live viruses, and they do not have the ability to modify the genetic code of the mother or baby. it has been shown that mothers who get vaccinated pass on the immunity to their babies through the placenta and breast milk. Now, which vaccine should I get? The answer is that all 3 vaccines are effective at preventing moderate to severe illnesses from COVID-19. And so when it is your turn to get the vaccine, you should get whichever one is available and safe for you. As you can see, do we have the slide up for the vaccine comparison?
Yes, you do.
Okay. As you can see from the vaccine comparison here, a number of different populations were used for the trial. If you see the section that says 100%, I always want to say in science, we don't have anything that we can say 100%. However, in this instance, with these vaccines, they are proving to protect against hospitalization and death from COVID-19 100%. The Johnson & Johnson vaccine was studied in the United States, in South Africa, and Latin America, where variants were circulating. It protects against hospitalization and death from COVID-19. There are no contraindications except a history of severe reactions or anaphylaxis. The AstraZeneca will be next in April 2021. It's going to be presented before the FDA. There's been issues with side effects from the vaccine. We need to wait to see after the presentation to the FDA. Nothing will be approved until it goes through the scientific committees. As a healthcare worker with a high-risk medical condition myself, I have been fortunate to work for an employer who values employees like me. I've been working remotely using telehealth, providing care to patients with COVID-19 who are in isolation, as well as other patients with regular medical conditions. We need everyone to get vaccinated and to continue to wear their face mask, to be socially distancing and avoid social gatherings so that we can avoid more suffering. We want to avoid deaths, and above all, we need to end this pandemic. Like you, I want to spend time with my family, with my friends. I want to visit my father in South Africa and just be able to travel all around the world. And I want a peace of mind knowing that our children are growing up like normal children. They have not been robbed from just being worried all the time about the restrictions of COVID-19. Thank you for listening. Please speak to your provider if you still have any questions regarding COVID-19 vaccine. And if you don't have any questions, please make that appointment for your vaccination when it is your turn. The vaccines are effective, they're safe, they are not an experiment, and they're free to everybody. And remember that getting vaccinated is an act of love or a gift to humanity. And with that, I just want to say thank you to everybody for listening.
Thank you so much for your wonderful presentation, Euredis. I am going to also go ahead and thank Rhonda and Alma because we do have to go back to the main room. But first, we're going to answer at least a question or two. In the chat, David asked, what do you say to someone who is concerned about unknown long-term effects of vaccination? Who can answer that question?
My answer is always, we're all in this together. And that, you know, there's so much in life that is a risk, but in this case, the benefits outweigh the risks. And so I encourage people to go because, you know, as many people are taking this, we're all in it together, and we'll all go through whatever may come or may not come. We'll all go through it together. Somebody else may have a better response, but that's been mine.
Thank you, Alma.
That's a good response, Alma.
Mm-hmm. Yeah.
Rhonda, did you have more to that?
Well, I will say that mRNA research is not new. It's been around a long time. And so I think that the vaccines are using a technology that already existed. It's just made specific for COVID. And that makes me feel more comfortable about the risk as I've learned more about the mRNA research. It's really a protein that helps our body code and be able to identify COVID so that it can fight it better.
Thank you for addressing that. Well, that's our time. Thank you very much for the information that you have provided. We are all going to go back to the main room for the wrap up. And if you need any information, you can reach out to all of these amazing ladies who are on the ground working for the people. We want to give them some love in the chat and let them know that we appreciate them for their dedication to the African ancestry community, but also anyone that has come to any of their agencies and their departments seeking help in regards to what to do. So let's give some love to Alma, Rhonda, and Euredis for what they do and leading the charge. Please click the link to go back to the main room for the wrap-up session.
Here?
What?
No,
Thank you, everyone.
No, do it.
Oh, put us on mute.
Scroll up a little bit and you should see a link for the wrap-up. Just click that link. And thank you to our tech, Miss Essence, for guiding us and getting our slides moving as fast as possible and getting us all connected. Have a wonderful evening, but head on over to the wrap-up session. All right, 30 more of you. Let's go, let's go.
Looking for the link.
I can't find the link.
No worries, I will copy and.
Oh, I find it to wrap up.
Found it?
Yeah.
Okay, I'll post it again. There it is right there. On your march, get set, click.